Hi, my name is Daniel Abdi, and I'm presenting results from our second biomechanics lab on the analysis of forearm muscle EMG activity during different contraction types. EMG activity is used to measure the amount of recruitment or activation of the muscle fibers during a contraction. The three different contraction types, concentric, eccentric, and isometric contractions, all require different levels of muscle fiber activation for the contraction to take place. Concentric contractions usually have to work against or in the opposite direction of gravity to be completed, whereas eccentric contractions usually work in the same direction and are aided by these gravitational forces. Thus, the purpose of this study was to analyze potential differences between forearm flexor and extensor muscle EMG activity during all three contraction types. The hypothesis was that concentric contractions would require the highest EMG activity to move the wrist against gravity, and eccentric contractions would require the least EMG activity as it is moving with the forces of gravity. To perform this experiment, 8 subjects were recruited from Regis University's DPT class of 2021 on a voluntary basis. 8 total subjects were used, ranging in age from 22 to 30, with a mean age of 25.13 years. There were 3 male and 5 female participants, all of which were required to be able to move through full wrist range of motion and be willing to shave hair from their arms. This is where preparation for the experiment began. Each subject was prepped by shaving forearm hair from their dominant hand's arm around the flexor and extensor muscle bellies. They then had their skin disinfected with an alcohol swab, and EMG electrodes were placed on the muscle belly of both their wrist flexors and extensors. Once the EMG equipment was set up and running, the participant's maximum voluntary contraction, or MVC, was measured in both wrist flexion and extension. This was done using manual resistance and cues such as to not let the researcher move their hand while providing resistance. The data was then collected using a 1-pound weight in hand. Once the EMG was recording, the participants were asked to perform a slow, controlled, about 5-second full range of motion wrist movement in both flexion and extension. Isometric contractions were also recorded by asking the participant to hold the weight with a neutral wrist while the EMG was recording. Peak EMG activity during all 3 of these contractions was identified and recorded in millivolts. After collection, the data was analyzed by calculating the means and standard deviations of each testing scenario using Microsoft Excel. Our results indicated that concentric contractions in both wrist flexion and extension produced the highest percent MVC in all 6 scenarios. This can be seen by looking at Figure 2, where the x-axis represents the contraction type, the y-axis represents the MVC measured in a percentage, with the blue bar representing flexion and the yellow bar representing extension. The percent MVC during wrist flexion was lowest during the eccentric contractions, and the percent MVC during extension was lowest during isometric contractions. It's also interesting to notice that the extension EMG activity was higher in extension than in flexion for all 3 contraction types. Figure 1 was also created to show the average total EMG activity in millivolts for flexion and extension during all 3 contraction types, in which concentric contractions again had the highest value. The fact that concentric contractions produce the highest percent MVC during both wrist motions supports the first part of our hypothesis. During concentric contractions, the muscles are shortening against the forces of gravity, indicating that muscle fiber recruitment needs to be higher. This agrees with previous findings in the literature, and it can be concluded that these types of contractions are less efficient. Eccentric contractions produce the lowest percent MVC during wrist flexion, however, it was not the lowest during wrist extension, indicating that the second part of our hypothesis was only partially true. The fact that eccentric contractions produce less EMG activity in some situations is interesting when thinking about other properties of eccentric muscle contraction. It has been found that eccentric contractions result in greater hypertrophy than concentric or isometric contractions. This indicates that eccentric contractions may be more efficient than other contraction types and also produce less stress on joints while still working in a productive way. The results that eccentric contractions did not produce the lowest percent MVC during extension may be due to some limitations, including some researchers having errors with the technology during the EMG recordings, inaccurate MVC measurements, and different hand weights used between subjects. Overall, understanding these results can be applied clinically as physical therapists. Understanding the concepts of loading during exercise, especially during recovery from injured tissue, can help prescribe exercise depending on the situation. Concentric contractions will produce the most muscle fiber activation, whereas eccentric contractions are likely to produce the least, indicating less stress on muscles. Research has also shown that eccentric contractions produce the most hypertrophy with the least cost, which may also be beneficial during explanation to patients of certain exercises. Thank you for listening.